All right. So, um, welcome to my presentation. My name is Dr. Erica Steele, and I am presenting a revolutionary weight loss program that I developed after 2 years. I originally started development of this particular program back in 2018 when I had an idea really about helping people to lose weight without a lot of the harsh treatments. And so when I say harsh treatments, this is even before Ozempic and all of the things. This was people, just really desperate to lose weight. And I kept seeing, them going into bariatric clinics or, having these rather harsh procedures. And then on the back end of it, experiencing a lot more issues like muscle atrophies and or just being left with like tons and tons of skin after the treatment. So really got me thinking, and I started to come in contact with some different service providers, and I began to use my experience and background in functional medicine and nutrition and all of that, and really kind of put those pieces together with some technology. So this is what I came up with. So again, my name is Dr. Erica Steele. I'm a holistic doctor in family practice. I hold 6 degrees in my field. I am working on 2 more graduate degrees, an MBA and a PhD. I've been in natural healthcare for over 20 years, and I am semi-retired. I closed my physical practice in 2023, in the summer of 2023. Kind of at the beginning of 2023, I knew I was going to be closing my practice. I just really burn out of, to be honest with you, of, just the one-on-one working through the pandemic, et cetera, and really wanted to do more things on a global scale. So I developed this particular program. It was wildly successful in my practice, so we did really well with it. Patients got amazing results after one session, and currently, right now, it pretty much just is sitting in a storage unit. And so I don't want it to be sitting in a storage unit. I'd rather it be out working, helping transform, and helping people make money. So this is at a good time. If you're seeing this in December, this is a really good Q1 launch because, of course, New Year's resolution, everybody is super, involved with their weight and weight loss and nutrition, et cetera. And so this would be a perfect Q1 launch. So the current trends in the wellness and fitness industry, as we know, there is an increased demand for weight loss drugs. And so the Ozempic and the Monjavis, or I think that's how you pronounce it, there's several different very popular weight loss drugs that have come on the market most recently that are being used off label. And so naturally, they are getting these results for patients. There are shortages of these medications, but also there's long-term risks too. It's not necessarily a quick fix. Of course, nobody really believes, at least in healthcare who have their chops, that there are quick fixes. But there is definitely a conversation that's happening of like, okay, this is great, but there's, this is great. This is going to help me lose all this weight, but there's really no long-term lifestyle change or long-term health risk conversations. And so that is an issue. And a lot of it's driven from social media. Now more than ever, especially with TikTok and YouTube and even IG, you've got a lot of people talking about it in the conversation. And so that's driving the market growth. So we can definitely capitalize on that demand, right? Because people are looking for the quick fix solution, but they're also looking for a natural solution as well. There is a growing interest in natural healthcare. And so if you can provide a just as effective natural healthcare long-term solution without all the side effects, you really have, a very, very unique offering. I would also like to say that I had this way before, those drugs came out. So naturally, I'd be like killing it right now if I was still, but the brick and mortar just got really, it was just a lot. Okay. So it kind of is the cornerstone of the package. It's actually 3 devices, and then we couple it with pretty passive nutrient and exercise plans. And by I mean passive, meaning like you're not gonna have to sit there and rack your brain in terms of how to create the macros. Starting off with the InMode. So the InMode Evolve device. It tightens, it tones, it body sculpts. It's a very dynamic device. We'll talk about it. I couple that with the InBody body composition device that also has an app attached to it. And that is a great check and balance to look at the body composition of the patient and really to give you those baseline numbers as well as the numbers that you're going to continue to track over the course of their care. And then we combine that data that we get from body comp along with we pretty much just put them on nutrition exercise plan. It's like, they fill out a little form, what they like, don't like, allergies, etc. And then we build something from there. And I'll teach you how to do that, where it's literally you can have a staff person in the office. That's all they do. Or, that's a part of what they do. Okay. So the InMode device, the InMode Evolve, is a very innovative device. So I became aware of InMode several years ago. I used to have another body contouring device from them, but it wasn't hands-free. And it also wasn't, it was their older Body FX, Mini FX that I ended up actually selling. This device is the next generation from that. So it's completely hands-free, which I love. It's also got more precision, so it's a lot easier to place these particular I guess they're like equipment. I love this particular device. Very sleek design, very elegant. InMode is really good at creating innovative, and that's what really impressed me about it. And that's kind of where the impress begin and end. The product is rock solid. Everything else, hot mess express. I literally, after kind of buying these machines, I kind of felt like I needed to take a shower afterwards. Like, it was not a pleasant experience. But the actual product is amazing, which is why I'm so excited to be able to offer this to other people, because you're not having to go through that experience like I did, and really benefiting from all of my trial and error, because I went through a lot in the learning process. So it has 3 modules on there. It's got a tone, a tight, and a transform. So it's an all-in-one system. And so they're all hands-free. They attach, and like the tone, for instance, what the tone does is it body sculpts, it rebuilds collagen. There is nothing that will rebuild collagen. I don't even give collagen supplements in my practice because I just don't think that they're as effective. But this will actually, it's FDA approved to rebuild collagen. And then also too, it muscle tones, which is also a dual purpose as well. I used to also use it on people that had atrophied really bad. So naturally when, they've gained all this weight and they've just the ligaments and tendons, all that stuff is stretched with the adipose tissue. They literally, like, I would have women with severe pelvic floor dysfunction, and I would set them up with this muscle toning and really just using almost as a biofeedback tool to teach them where their muscles were again, right? And also to really help with low back pain. And I mean, there's lots of different uses for the toning device, even for bodybuilders and people, bikini competitors right before, because obviously they can't use any other, devices or other things that are going to give them a competitive advantage. This was a really good competitive advantage for them. And as you know, people that are in that space, they spend quite a bit. And so this is, again, is more of that kind of body shaping. It also, it has a vacuum on there, and it does kill and shrink fat cells, which is absolutely amazing. You actually see results after the first session, which is just phenomenal. So it really helps, motivate people. You can use it just about anywhere on the body. I wouldn't use it like underneath the chin per se. InMode does have another device for that, but like, your butt, your thighs, your arms, obviously your abdomen, your back. I mean, we've used it just about anywhere. Okay, so jumping back. So yeah, I mean, the InMode device tightens tones, builds collagen. It's an incredible device, very innovative in the space. When InMode was the first aesthetics company that I ever worked with. However, before you make these, like, I mean, literally, like, some of, these devices are like a house. So I, did my due diligence. I looked at all of the different technologies. I met with the reps. I really did my due diligence and my research because I am very results driven in my practice. So I wanted to make sure that I was, purchasing a product or investing in a product that actually got results. And so I definitely recommend InMode, their product, not their sales pitch. Okay, so and so it's hands-free. The device is hands-free. I don't know why the picture didn't show up, but it's hands-free. My particular device that I own is from 2020. That's the one that I'm selling. I have all the paperwork for it. It has all the hand cradles, extra clips, extra bands. It's literally like new. I keep everything super pristine. And it, again, tightens, tones, trims, and it works on fat, muscle, as well as skin. So then I use so part of my consultation, so the patient would come in and we would offer a consultation. We would put them on the InBody. So the InBody is a leader in body composition. So it's going to show us their weight, but not just their weight. It's also going to show us their fat, their entire body, plus spot sections of fat, visceral fat, lean muscle mass, total body water. It does have an app with it where you can track it, where the patient can track it alongside, and also they do sell, I think, little scales as well that the person can take home. But this is one in your office, and this is a very very elite scale. I have tons of stuff with it too, like in terms of like the sheets and all that. I just bought a lot of extra things to have proper equipment. And so this is an absolute just gem in the practice. It is a game changer when it comes to nutrition and fitness. People in the nutrition fitness world are very familiar with this device. You can even, I even did standalone evals, like $45 standalone evals. I would put children on it, evaluate them, especially for preventing childhood obesity. I mean, it really, gives you the data necessary to be able to now create an effective nutrition and fitness plan for your patients. So in the consult, they would come in, I would sit down, have a conversation with them. We would look at the areas of the body that they're concerned with. We would take photos. We also have like a little mat that they would stand on that actually, kind of gives you all the dimensions of all the pictures, because taking before and after pictures is very much an art form, believe it or not. And so, we have a guide for that to help assist. Naturally, I'll do all the training, and so you'll have all that information. But this particular InBody was also a part of that process because we're building out their nutrition and fitness plan. So we do the consultation, we talk to them about the benefits, we talk to them about the risk. There really are no real risk per se. We would talk to them about their goals. We would evaluate if their goals were realistic, because naturally, if they have, a lot of hanging skin, or, there may not be a candidate for body contouring. Now, there have been people who have been severely overweight who really needed more like a tummy tuck, or, needed a more invasive procedure. However, they were really dead set on non-invasive procedures. And so we said, okay, fine. This is also a really good tool to prevent patients that are losing weight, so they can lose weight gradually. So at the end, they're not left with a whole bunch of skin, because naturally with especially with bariatric procedures, unfortunately, they will lose their weight pretty fast, and so they're left with tons of weight because of the tighten and tone component of this machine, and the way that we build up this program. They won't be left with that loose skin afterwards, which makes it really appealing, and can save them thousands of dollars. So we do evaluate in the consultation if they are a candidate or not. Like I said, we take all this data, we put them on the machines, we take their photos, and then we pretty much present to them our plan, which I'll go over shortly. In terms of our nutrition, I will teach you a very easy, streamlined, being a naturopath, we deal with nutrition all the time. Let me tell you, meal planning is my least favorite part of my job. And so I have figured out ways to make this so simple, so easy, so replicatable, so passive. And it's a situation where even after they're done with their treatments with you, you can continue to sell them nutrition and exercise plans. If you go to my website, I have pre-done nutrition fitness plans that I have maintained, and we sell them even after the fact. So it's a very results-driven practice. So you're going to do that comprehensive consult with your baseline numbers. Now, I'm also a functional doctor, so I will include functional labs and supplements involved in that, but you don't have to if that's not your education or training or experience or comfort level or whatever. But we would do functional labs on the patient. We would give them a supplement package. We would give them nutrition and meal plans and their fitness plan in addition to the work that we're doing with them. So they would have weekly check-ins where they would come in. Also, there's an electric blood pressure cuff that we include there too. So they would come in and we would do the electric blood pressure reading and pulse rate to modulate their stress response. We would check their numbers, meaning that we would put them on the InBody. We would also check their tracking numbers. Like the patients have to track their food during this. Even if even though we're giving them a meal plan, they have to track their food. They, can take photos of their food. We are going to take photos of them as well. And then every week they're going to be on the InBody, ideally at the same time. And then they get weekly Evolve treatments. And so we're tracking their blood pressure. We're checking their nutrition numbers, we're checking their photos, we're checking their body biometrics, and then they're doing a 1-hour treatment, which I'll go over a little bit how we structure the time, 1-hour treatment once a week. It's a 12-week plan, so they're coming in for 3 months, so 1 week for 3 months. There's opportunities where we sell topicals. I can give you the information for that in the training because there's some really good topicals that kind of work in between sessions. You can upsell your nutrition and your fitness plans, which I can show you very easily how to create that. You can upsell your lab testing. Let's say if that functional lab, of course, if you're a functional provider, you could do this. Let's say you do the labs and let's say their thyroid is looking a little off. Now you could say, oh, let's do a comprehensive hormone panel. Let's do an organic acids metabolic panel. Let's look a little bit deeper, and that way we can really fine tune your supplement regimen. Because let's say for instance they have mold in their system, they have mold in their liver, whatever, very difficult for them to lose weight, and they're not going to get the results in the plan that you want. So you're an organic acids profile, you go, boom, okay, there's mold in your system. We also have to include that as a part of the process to clean that out so you can really break through that wall and lose weight. There's always, with weight loss patients, typically there's always a wall that they in the past have never been able to break through for whatever reason, whether that has been because there's viral infection in, their system, whether there is mold exposure, whether it's stress eating, lack of consistency, discipline, whatever, just, I don't even know what to eat, whatever that is, you have to break through that wall. And again, I will be with you for 3 months to train you all the things. As you can tell, I love to teach people all about this stuff. And so, it is such a phenomenal program to see people in such an empowered place and to see them go from where they're originally to this transformed self. It's amazing. As I've alluded to, I will be on to train you. Now, I was trained directly by InMode. I also had their marketing package initially when I bought my first machine from them. So I went through all of that. I flushed it all out. I dissected it. I broke it down. I organized it. I made it my own, and I made it so that it flowed better, because naturally they're selling equipment. Now there's a lot of hype in the selling equipment that unfortunately you buy into and then realize, oh, wait a second. I definitely learned a lot in the journey and in the process that I am very grateful to pass on to you, so that there's shortcuts and you can just, out of the box, boom. So we'll ship the device to you. We'll send you all the manuals, and we'll do 3 in-service trainings. So one is going to be just for setting up the device and getting comfortable with how to use the device. And we'll do this all through Zoom. And then one for sales training. We'll do sales and marketing training at that same time. And then one for best practices and answering any questions that you kind of have coming up. So we'll do ongoing support for 3 months. So there's a lot that happens in that 3 months. So we're going to outline a full marketing plan for you. So I am a current MBA student. I've been in business for over 20 years. So, I'm going to audit your website and create a plan. I'm going to audit your social media and create a plan for you. We are also going to do a new service launch. It takes 3 months to do that new service launch. So think about it like, I do all this upfront stuff. I'm going to ship you all your device. We'll do all the training. We'll start implementing this marketing stuff and then building up into a launch. And then once you're launched, boom, I'm like out. And if you want to contract me to stay on, I'm happy to do that. But really, like, once we get your launch, like, you should be, wash, rinse, repeat, as they say. The cost of the full package is $85,000, and that includes the 3 devices, plus the marketing, plus the training, plus, all of the coaching and support throughout that period of time. Now, if you're anything like me, also I will mention the InMode Evolve device is a lot more when you buy them outright from the reps. Again, like, very used car lot vibe with that. I will say I did it twice. It's kind of crazy. I will also say too that you could buy, any of these devices kind of stand alone and piecemeal it all together. But the real magic is putting it together and all of my systems, processes, market. Like, I'm going to take you direct. You're not going to have to, do the whole dog and pony show and all the hard knocks and all the learning, because I've already done that for you. I've already flushed out and, been through the desert of all of that. So let's talk about return on investment, because I know whenever I listen to pitches as a practitioner, as a business owner, I'm like, okay, great. It sounds wonderful, but how am I going to get my money back? How quickly am I going to get my money back? So what I did was, for the 3-month program, I did $1,000 a month. So it was $1,000. And the $1,000 a month was very strategic, by the way, because, and also too, it's dependent upon your area and all kinds of factors, but I wouldn't go below $1,000 a month. $1,000 a month is actually pretty cheap. You could go up if you wanted to. I liked that number. It was palatable. It was like, oh yeah, no brainer. Like, it was just very easy to sell at $1,000 a month, because it's like, oh, okay, so I'm coming in, I'm doing 4 treatments. I'm, having, all of this. Pretty much you are loving on them, supporting them, encouraging them, you are literally doing it. It's very cool. Like, they'll come in, you'll do your, like, let's say after the consult's done or whatever, they'll come in, they'll check in. Like, we used to have, organic robes they'd sit in, we'd bring them water, like, we would make it a whole thing. And so they would come in, we would take their photos, put them on the scale, take, do the whole thing, check in, make sure they're good, while another patient was being serviced. That check-in process was about 15 minutes. And then the last patient would, be done, moved, and then they would go into the room pretty much for 45 minutes. Because it's a hand-free device, you are just setting it up, right? You give them a little buzzer just in case. You set it up. The first go round is only like 15, 20 minutes tops. Feels really good. Oh, also, I will mention that this $3,000 is only one area. So if they want to do, let's say they want to do their waist and they want to do their arms, that's 3,000 times 2. So, there's different areas. Most people want to do their midsection. That's pretty common. Some people will go, oh, I'm going to do my midsection, my arms, my back, whatever. So just so you know, that's one area. And you give them a little bit of discount if they do multiple areas, that kind of thing. So we would set them up. They would do their first round of treatment. And then in about 15, 20 minutes, we would come back, disconnect, reset. And then the second go round was about 20, 25 minutes. So really, and that's where the muscle tone happens. So it was about 45 minutes of treatment time, 15 minutes of prep, 5 minutes of cleanup. So really, you're if you're doing them back to back, you have one person checking in while one person is finishing up, and you just rotate. You're going to need 2 rooms if you work it like that. Now, you could do just one room and that, but we found from a time efficiency perspective that running the 2 rooms was better that way. And we had like a whole place, with all kinds of different rooms, so it was easy for us to make that happen. Your break even is going to be around 29 patients. So at 85,000, your break even is 29 patients if you're billing out at $3,000, right? So your return on investment really happens when you service. Your goal really is to service 100 patients. And so at that level, you have a substantial return, and you recover your initial investment naturally, as well as additional revenue generated. It's more than double of your original cost. So very easy to trend. You can, depending on your hours of operation and your staffing and all of that, servicing 29 patients is pretty much a no-brainer. That can be a month. You service 29 people in a month, and boom, the rest of the year is all profit. So another thing to consider is time. So time investment. So each session is about an hour long. They're going to do 4 sessions in a month. Obviously, if the month has 4 weeks, most months have 4 weeks. And the package duration is 3 months. So that's 12 sessions in total. So it's 12 hours per patient for the entire package. So you just want to consider that, especially if, let's say, you are hiring, for somebody to come in. You can train just about anybody on this particular treatment. There's not a whole lot to it. I've trained people with no medical background whatsoever. I've trained people that are estheticians. I've trained people that are massage therapists. I've trained people that are medical assistants. All in that real wheelhouse pretty much works. And you're just teaching them the different components. And again, I'll help you with that. Your target market for this particular program is anybody seeking non-invasive weight loss solutions. So a lot of people do not want to do surgery. They don't want to, go under anesthesia. They just don't want, not to mention the cost. I think Average tummy tuck is probably around $6,000 plus there's downtime, etc. And that's without lipo. If they have to have lipo with it, now they're looking upwards 10, 12, $1,000 plus downtime and surgery and all that kind of, medication, all kinds of stuff. So there is a definite market for people that are looking for non-invasive weight loss solutions. I talked about it a little bit before, but there are patients that are, obese and overweight. And while you may not necessarily like they may have to do this a few rounds, but because you see results so quickly, I mean, every patient that I hooked up to this device, guaranteed they were like, oh my gosh, love it. Like they could feel a difference. And you can see a difference. So it wasn't like, a lot of times in natural health care, like things are a slow burn. Like it takes a while for you to be able to see results. This is after the first treatment, you can tell a difference. So very powerful. Whether their, pants fit differently or they just felt tighter or more tone. So even if you service patients that are severely overweight, they are going to have results. Post-bariatric surgery patients, you wouldn't think about that, but it's just because they're looking for ways to maintain their weight loss and improve their body toning. And that's why, that they're a good market. Plus, if you're a functional medicine provider, naturally those patients you have to manage because they can only consume a certain amount and they're always going to need to be on some sort of supplementation so that they don't go into muscle atrophy. Patients with metabolic health concerns, so type 2 diabetes, metabolic syndrome, especially measuring their visceral fat is key. And it is very rewarding as you're measuring that visceral fat and you're taking them out of metabolic risk. Like that is like, whoa, like I love that part. Fitness enthusiasts, I talked about this before, like people that really want to enhance their muscle tone and their definition, bodybuilders, people that are competing, those are really good candidates for this particular device. There are people who are very savvy about body contouring and aesthetics, and they love that world. So naturally, they're super easy to sell to because they already love in it and believe in it. Naturally, people that want a really structured and accountable weight loss program. So some things like, let's say Noom, for instance, that was really popular for a while. Noom is good for the psychology, but it's not fairly structured. Like, if you're asking a patient, okay, how many grams of proteins, fats, and carbs, they don't know because of the way that Noom is structured, right? And nothing against Noom, but that is kind of a one approach, right? Similar to like, let's say, Weight Watchers, where you're like on the point system. This is very much like numbers, structured accountability. In our practice, we really stress on education, coaching, and accountability. And that's what this is. There is no wiggle room. If every week you're coming, like we're going to know if you're not following the meal plan. It is obvious. Like if you follow the meal plan, you're going to have a guaranteed 1 to 1.5 weight loss per week. That's how much we've dialed it in. We don't really recommend more than 1.5. It's not considered healthy, but a person can go up to 2 pounds per week. But typically we see healthy is 1 to 1.5 pounds of weight loss per week. So you can backtrack that down and say, okay, if I need to lose 30 pounds, then, blah, blah, blah. So good for people that, and also too, definitely having that conversation. Do you have a goal? What's your why? Why do you want to do this, etc.? Those are all really good things to help encourage them, especially if it gets tough. Busy professionals and parents who want a weight loss method that they can fit into their schedule. A lot of times this becomes almost like a respite for moms. The tone part of the machine, the one that builds collagen, is really great for mommies who have twin skin. So meaning moms that have had twins. I have a photo. It's not in this presentation, but we did one session with a mom who had like just her skin was stretched out from having twin babies. And after one session, you could already see it like shifting up. It was incredible. And so that's a good target as well. And then just people who are really health conscious already, they're looking for modern technology based, they're looking for a biohack solution. Like this is very much in the biohack world. Like I have cultivated all of these things, especially if you're into functional medicine, like combining those pieces, which I'm happy to share and teach and all that kind of stuff. My systems for that. If you combine all of that together, like, whoa, like you have a really powerful program, that sees results. I mean, we have had patients that, they have tried everything. I mean, everything. And they have succeeded. I mean, I have patients that are 60 that are now, back to how they were in college, like it is very, very possible, especially with this program. I will accept payments because I do know, not everyone has $85,000 sitting around. And so be nice if we all did, but some of us don't. So if you do pay in full, I do provide you a 5% discount. And I offer pretty much 3 payment options. Naturally, if you do monthly payments, there are going to be some interest on that. And so the monthly payments for the interest is, a little under 14.5. And then I took out the balloon payment. I don't know why. I really, it's supposed to say down payment, not balloon payment. So down payment. So there's a down payment for the first month and then monthly payments for 5 months. So I'll do the payments up to 6 months. I won't extend it past that just because I own this equipment outright. I just want to be done with it. I have way too much in a storage unit, and I semi-retired, moved. I'm moving into the education space, and I mean, still treat patients, but moving more into the education space, and I really just want to let this go and be done with it. So, and it doesn't make sense to bring it to a tourist area. So, all right. So if you are super excited and you're like, oh my gosh, this makes so much sense, I'm ready to get started for Q1. This is what the process would be. Of course, after we do all of the what so and contracts and all that fun stuff, the first step is our market research. So I will give you all those trends, identify your target audience in the area that you're in, analyze your competitors. I will also teach you about the devices so that you know them, you are able to communicate. I will provide you case studies and testimonials that we have. I will, and also we've gotten those things from InMode as well. So I will share all of that, and then we'll develop that business plan, real bare bones. Like it doesn't, we're not going to do an executive summary and all this craziness, but we are going to outline your goals, your strategies, your financials so that you are prepared. You know exactly what you're doing, why you're doing it. Now, if you are already business having and you already got it, like, please tell me to do whatever. But for the most part, I just want people to be successful. This was not done when I purchased. I was a little naturopath, very naive, and I was sold my first InMode device. And literally, they did an event with me and that was it. Like, there was not a whole lot of support involved. There definitely a lot of communication, but I wouldn't necessarily say a lot of structured organization like that. So we will set your pricing. We'll figure out what works. I will give you your best practices because there's a lot of little tricky things involved with that. We will also create your brochures, presentations, and we'll work on your web content within reason. Like we'll create some landing pages for you and stuff like that, make them really pretty. And then we'll start to structure your social media for you and email marketing and also your ads, because you'll want to run some ads, especially to promote your event. So then we'll obviously do the full training, make sure you know all the devices. There's no certifications per se that we offer you. But we'll make sure that everybody's got, their adequate amount of education. And then we'll start to kind of build that sales pipeline for you so that you kind of understand where your customers are coming from. We'll work on the client engagement. So we'll make sure that we have full presentations. Because this is a higher ticket item, you really want to make sure that you're presenting it in that way. I cannot stress that enough. You don't want to present it like it's a foot detox or a dry sauna appointment. Like you want to present it like this is like special and this is VIP and this is, you really want to make sure that they feel almost luxurious for achieving this. Because if you create that ambiance around it, almost like super high-end med spa, they are going to absolutely love coming to their appointments, which means they're going to put their all into it, which means that they are going to get results and go out and tell 10 of their friends. So we can talk about how to keep in touch with your patients, negotiate deals, terms, and prices, close them, and then onboard new ones. And then naturally, I will teach you the product launch. It does take a while. That's why we have to start with all the marketing stuff, because there is a whole process to the product launch and there's a lot of moving parts involved. And so realistically, what will happen is I'll come on board, ship the device, start with the training, start with the marketing plan, get all that together, and then we'll start getting those assets put together while you guys are getting more comfortable with the device. And because we need that lead time. 3 months is not a long time, let me tell you, especially in the marketing world. So we'll need to make sure that we have enough lead time to get all the collateral in place, get everybody trained, get everybody sounding amazing and being able to sell it. And then we have this really big, amazing, and then we'll put PR in there. Like we'll have this really big event and it'll be amazing. And in that event where you're introducing this, that's where you're really there to sell packages, and there's a whole strategy around that. So it's potential. I mean, I'm not going to sell you the world, because I mean, you could knock it out of the park and sell your 29. I doubt it though, but if you get, like, let's say you get, 10, right? Or 5 or 10, that gives you a jump start, right? If you get 15, like, whoa, you're rocking it, right? And so, and you can do that if you're in a good market. So it just depends on the market, and it depends on how everybody comes together and that sort of thing. My events were crazy. I still made, however, InMode did not listen to me while I was telling them about my market, and they sent somebody out who was like right out of Miami, and in the South, and the South is a little bit more reserved. And so, somebody coming from, straight from Miami, right off the beach, plastic surgery galore, definitely was not a vibe. And so that's also why we want to look at the market and make sure that we are appealing and attracting to your demographic, so that when you have your launch event, you'll have the greatest success. So again, I've been through the weeds, and I don't want you to have to go through any of the things that I experienced, but I definitely want you to get maximum results for, what you're investing, and be able to have this as just a fully, functioning part of your practice, and something that, people come to you for years and years and years and refer their families, their friends, etc. So thank you guys so much for tuning in. I really appreciate it, and I really look forward to working with each and every one of you in the new year.